Good morning, everyone. My name is Dr. Jahangir Beigh, and I'm a consultant interventional cardiologist at Khyber Medical Institute. And today I'm conducting this Facebook Live session as a part of an awareness campaign regarding hypertension. I will be specifically talking about the relationship between salt intake and hypertension, how excessive salt intake over a period of time leads to high blood pressure or hypertension, and how this affects your health over a long period of time. I'll in the end also give you some tips about how to reduce salt intake in your diet to maintain a good cardiovascular health. So let's begin by asking the basic question: what is salt? Salt, as many of you may know, is a combination of sodium and chloride. The active component of salt, that is sodium, is an essential mineral nutrient which is required for normal body functioning. Sodium is important for maintaining normal fluid balance in the body. It is also important for transmission of nerve impulses and maintenance of normal muscular function. Sodium is also an important component of various enzymes which are essential for normal body metabolism. So how do we consume sodium? Sodium, the most of the sodium that we consume in daily is in the form of salt, which is added as a condiment for flavoring of our food. Also, sodium is present in various other forms in the food we consume, like monosodium glutamate, or baking soda, which is present in our breads and breakfast cereals. How much salt should we consume? The WHO that we should take no more than 5 grams of salt per day, which is roughly around 1 teaspoon. The actual physiological requirements of the body are around just 2 grams of salt per day, and this is especially important for those who are already having high blood pressure or hypertension, or those who have diabetes, or those who have high blood cholesterol levels. An average Indian diet contains around 10 to 15 grams of sodium. This is roughly 2 to 3 times of our daily body requirements. So how does excessive salt intake damage your health? When you normally when we consume salt, the amount of salt that is not used in our body is excreted via the kidneys, and this salt along with itself takes some water along with it to form urine. When we consume more than recommended amounts of salt every day over a long period of time, this overwhelms the capacity of kidneys to excrete salt. Consequently, salt gets retained inside the body, and along with it some water also gets retained in the body. This leads to increased blood volume, and which in turn exerts more strain on the blood vessel walls, and this consequently leads to hypertension. Hypertension over a period of time has damaging effects on almost all organs of your body. It has a negative effect on your heart, on your kidneys, on your brain, and on your eyes. When we talk about heart, long-term hypertension leads to increased workload on the heart, and this leads to thickening of the heart muscle, which we call as left ventricular hypertrophy, and this over a period of time causes heart failure. Hypertension is also an important risk factor. Hypertension is also an important risk factor for coronary artery disease, which is a disease in which there is excessive deposition of fat on the blood vessel walls, and this leads to narrowing of the blood vessels and increased risk of developing heart attacks. In kidneys, long-standing hypertension causes fibrosis of the kidneys, and this over a period of time can lead to renal failure. In brain, long-standing hypertension causes thickening of the blood vessels within the brain. Sometimes these vessels may rupture, and this can lead to brain hemorrhage, and sometimes these vessels may narrow down, and they can get blocked and can cause stroke. Small vessels which can damage over a long period of time can lead or what we call as dementia. Long-standing hypertension damages the blood vessels within the retina, and this leads to what we call as retinopathy, and this can lead to impaired vision and sometimes even blindness. It's important to know that some people are more salt sensitive than others. For example, two people take equal amount of salt. One patient may have exaggerated response to high salt intake. Those people we call as salt sensitive people. And some people are less salt sensitive, so even if they consume more salt, they do not have such exaggerated response to high salt intake. So especially if you are, a salt, you may have more damaging effects to your body as a result of long-standing high salt intake. So how can we limit, our salt intake in our daily life? In medical terminology, in our medical field, we call salt and sugar as two white poisons, because both of these ingredients, if we take, persistently in high quantities, they can damage our health. So the golden rule is you should develop a taste for low salt and low sugar diets. When you consume less salt and less sugar, over a period of time, your taste buds get adapted to less salt and less sweet stuff, and consequently you start disliking high salty and stuff, and this is really good for your health. When we talk about limiting our salt intake, it has to be done at various levels. It has to be done at home, it has to be done when you go for grocery shopping, and it has to be done when you go out for dining. At home, you should add less salt in the food that you cook. You can use alternative ingredients like vinegar, like garlic, lemon juice, or various herbs to add flavor to your food without adding excessive salt. And you should also increase the consumption of fresh fruits, vegetables, and dairy products which are and are good for your health over a period of time. When you go for grocery shopping, you should try to avoid buying processed and canned foods which have a very high sodium content. You should also avoid buying salted chips, salted nuts, and namkeens, which most of us are very fond of. You should try to avoid buying them. You should also avoid buying pickles, sauces, ready-made gravies, which not only contain high salt, they also contain bad for your health. When you buy your breads and breakfast cereals, you should items, and you should try to buy those items which have less sodium content. When you go outside for dining with with your family, you should try to avoid and consume fast foods like pizzas, burgers, foods that have very high. When you go to a restaurant, you should remove the salt shaker from your table, and this will avoid the temptation of adding more salt to your food. While placing an order, you should be specific about what kind of food do you want, and how do you want it to be cooked, and what amount of salt you want to put in it. If your food tastes bland, you can add pepper, you can add lemon juice, or you can add other spices or herbs to flavor it up without adding more salt. So these are the ways by which you can reduce the sodium consumption in your daily life, and this can really have good effects on your cardiovascular health in your long-standing life. And finally, I want to end by saying that WHO says that if all of us limit our salt intake to the recommended levels, around 25 lakh deaths, that's almost 2.5 million deaths, can be prevented every year. And this is very important to know. I hope this video was informative, and I will soon upload a video in a local Kashmiri language as well. I thank you very much for your patient listening. Till then, take care and goodbye.